Hello and welcome to a brand new episode of Health360. Well, on the show this week, a reminder for our viewers that the COVID-19 pandemic is far from over. It is the relentless return of the infection, even though the global emergency associated with what was known as the novel coronavirus, or SARS-CoV-2, has been ended by the World Health Organization. Well, as of today, if we were to factor in the beginning of 2025, there have been a total of 5,000 recorded cases in India. But the fact is, the actual cases could be much more because people aren't testing, so hence round about 5,000 cases. The surge in COVID-19 cases this year have been driven by 4 variants, all of them from the Omicron family. These are LF.7, XFG, JN.1, and NB.1.8.1. Deaths have also increased. It stands at roughly 50 since the beginning of this year, including the death of a 5-month-old baby with respiratory disorders. So what is this wave? How worried should you be? What are the precautions to be taken? We're answering all those questions for you on the show today. I'm Sneha Mordani. This is Health360. Viruses, including SARS-CoV-2, the virus that causes COVID-19, change over time. Most changes have little to no impact on the virus's properties. Some changes may affect the virus's properties, such as how easily it spreads, the associated disease severity, or the performance of vaccines, therapeutic medicines, diagnostic tools, or other public health and social measures. Hence, we track these changes. Now, in the month of June 2020, the World Health Organization's Virus Evolution Working Group was established with a specific focus on SARS-CoV-2 variants, their phenotype, and their impact on countermeasures. This later became the Technical Advisory Group on SARS-CoV-2 Virus Evolution. In late 2020, the emergence of variants that pose an increased risk to global public health prompted the World Health Organization to characterize some as variants of interest and variants of concern, in order to prioritize global monitoring and research and to inform and adjust the COVID-19 response. Well, as of the most recent classifications of the WHO and Center for Disease Control and Prevention, there have been 5 major SARS-CoV-2 variants designated as variants of concern during the COVID-19 pandemic. These variants were classified based on increased transmissibility, severity, and or reduced effectiveness of public health measures. The 5 WHO-designated variants of concern are as follows. The first one is Alpha B.1.1.7, first seen in the United Kingdom in the month of September 2020 and designated the same in the month of December 2020. The second one was Beta, which is B.1.351, first seen in South Africa in the month of May 2020 and designated the same in the month of December again 2020. Gamma, or P.1, first seen in Brazil in the month of November 2020 and designated the same as a variant of concern by the WHO in the month of January 2021. Then Delta, which is B.1.617.2, first seen in India in the month of October 2020. Remember, this was the same variant of concern that caused widespread death and devastation in India. It was designated as a VOC in the month of May 2021. Then came Omicron, B.1.1.529. It was first seen in South Africa, Botswana, in the month of November 2021. And it was designated as a variant of concern in the same month. Well, as of 2024-2025, Omicron and its sublineages like XBB, BA.2.86 and JN.1, which is being seen in India right now, remain the dominant globally circulating variants, but the others are no longer active in circulation. As of mid-2025, the Omicron lineage remains the dominant variant of SARS-CoV-2 globally. Several subvariants have emerged, each with distinct characteristics. Which are these ones? JN.1, BA.2.86, NB.1.8.1 and LF.7, all of which has been seen in India. JN.1 is a subvariant of the Omicron lineage of the SARS-CoV-2 virus, first detected in September 2023. Well, it has since spread to over 40 countries, including India, and was classified by the World Health Organization as a variant of interest due to its rapid global spread. Let's tell you a little more about the symptoms of JN.1. The symptoms associated with JN.1 are mild to moderate and may include fever, which is regularly seen in all COVID infections, a runny nose, which can mimic something like a common cold, a sore throat, which again is very common, headache that we've seen in many other variants as well, cough, fatigue, and muscle weakness. Also, loss of appetite, gastrointestinal issues. These symptoms typically improve within 4 to 5 days. Extreme fatigue characterized by overwhelming exhaustion is actually a notable symptom of JN.1. A lot of patients are reporting the same. What about the severity and risk? And that really is the moot question here, given the kind of worry that COVID has caused over the last 5 years or so. The good news is that most cases of JN.1 are actually mild, with less than 10% of cases becoming severe. That's quite less, particularly among older adults and individuals with pre-existing health conditions. The overall fatality rate remains low, and many patients recover at home itself. The JN.1 variant has mutations in its spike protein and may allow it to partially escape the immunity developed from earlier infections. Well, what does that really mean? Which means that your natural immunity is something that may not protect against this infection, and maybe the immunity from vaccines also will not be protecting you to a great extent. Well, it's been 5 years since the outbreak of the COVID-19 pandemic. It's still a pandemic. It is though not a concern globally, in the sense that the emergency associated with COVID has ended officially last year. However, it continues to be a pandemic, and as we know and as we've been seeing, cases of COVID in India and outside of India are also increasing. Not just cases, deaths are increasing, and deaths are being reported as well. To talk about COVID-19 and how it is alive and kicking, this infection has not gone away, is Dr. Randeep Guleria. He's joining us, former director of AIIMS. He was always the voice of reason when we had just so many queries during the peak of the pandemic. I'm going to thank you here for joining in, Dr. Guleria. It's a pleasure to have you on the show once again.
Thank you.
Sir, I want to begin by asking you, what has really happened, sir, over a period of time that we've seen in just so many months, where we didn't see a surge like this, and we also did not see deaths in comorbid individuals that are now being reported. What has changed all of a sudden, in your opinion, in the last few months?
I think it's very important for us to remember that COVID-19, SARS-CoV-2 has not gone away. It is still around, but things have changed, and from a pandemic situation, we've become an endemic situation. The virus is there, the virus will continue to mutate, and when it mutates, it will change its character. We saw it, we had the alpha wave, the beta, delta, and then the Omicron wave, and now the Omicron sublineages are there. That is causing a surge in the number of cases, because whenever you have a new variant which comes in, it has two things. One is it develops an immune escape mechanism. It can therefore escape the immunity that we have developed and therefore cause more infection.
Okay. I want to ask, come to that in a moment from now. But first, a little about the variant in question. Here is the sublineage JN.1, which is, of course, from Omicron. I want to understand from you, it does appear that it is more contagious than the other variants that emerged from Omicron, basically more contagious than its brothers and sisters essentially. Why so? And also, in a situation like this, the vaccine that I took, or everyone took essentially about 2 years ago, or 3 years ago rather, is that going to still offer some amount of immunity?
So the variants will keep changing, and like I said, they will try and become more infectious. This variant has also had some mutation than what we call the spike protein, which leads it to becoming more infectious. It spreads more, and over a period of time, as happens when we don't have the infection for some time, overall immunity in the population comes down a little bit, and therefore the virus is able to spread more rapidly. And that is what we're seeing with the new variant. It is having the capacity to spread more rapidly because it's of the change that has happened, the mutation that has happened.
Right.
And the community also, there is a little bit of waning in your own immunity, and that is contributing to this. The vaccine that we've taken will give us some protection. It's not that's going to be as good as the protection that we had in the beginning when we were having the original strains, because the virus has changed significantly, and therefore the efficacy of the vaccine has also come down a little bit, because we are now taking the vaccine that we took was against the older strain.
Absolutely. In that sense, many would ask, a lot of people had never taken the third dose of the vaccine. So should people now go ahead and take the third dose? Does that really make any sense?
No, I don't think that makes any sense, taking the third dose now, because the dose that we have, or the vaccine that we have, covered the Wuhan strain. After the Wuhan strain, the original Omicron, the original strain, we had the Alpha, Beta, Delta, the Omicron, and the current mutation is the sublineage of the Omicron strain. Therefore, taking the older vaccine will not be that beneficial. Most of us have developed some degree of immunity because over the last 2-3 years, we have had mild COVID, and we therefore have probably developed some degree of immunity on our own.
Okay. Should we be going ahead and taking the flu vaccine now? It changes every year. A lot of people take it. Mostly kids are being given. But should somebody like me, senior citizens, comorbid individuals, should they just simply go ahead and take the influenza vaccine and do it every year after year?
Yes, so I think the flu vaccine should be taken by everyone, and especially the elderly and those with comorbidities. Influenza is the other viral infection which tends to circulate during this time of the year. That is during the pre-monsoon and the monsoon months. We do see a peak of influenza infection during this time of the year, and that is also a respiratory viral infection. These two viral infections are the one which usually cause a flu-like syndrome, that is fever, cough, cold, and can cause a more serious illness in the older age group.
Okay, at the very outset, you mentioned senior citizens, so I want to ask you, these are basic questions, Dr. Guleria, that a lot of people are asking. Should senior citizens now make an effort to stay at home, not venture out?
So I would say now we're seeing a surge of cases. Senior citizens should avoid going to crowded places or to places where there's a chance of getting the infection. If they have to go to such a place, they should wear a mask and follow COVID appropriate behavior in terms of using a sanitizer, washing your hands, maintaining a physical distance. But if they can avoid going to a crowded place, I think that is better, especially if it's an indoor crowded place, because there the spread of infection can be more rapid. And since we have a variant which is more infectious, they need to be more careful because they are a little high risk of developing more severe infection.
So I'm also presuming this applies to even individuals who are comorbid, isn't it? That the same rule applies to them.
Correct. So if you have underlying comorbidities, then you should also, and especially if your comorbidity is not under good control, if your diabetes is not under good control, you're on, or you have other chronic diseases like you're on immunosuppressive drugs or you're taking chemotherapy, I think you should not go to such places.
Okay. Return of the mask, the N95 mask, should everybody start wearing them in closed settings? Like, should I wear it in my office? And what about senior citizens and comorbid people? When should they be wearing it? At all times, or only when they're going to crowded places and stepping out?
So if you're inside and you're in an environment where just your family members are there and none of them have flu-like symptoms, that is fever, cough and cold, I don't think then you need to wear a mask. But if you're going out to a place where you're meeting people and some of them may be coughing or having a cold, it may be worthwhile, especially for the elderly and the high-risk group, to wear a mask. I don't think everyone needs to wear a mask because in the younger age group, the current trend that we're seeing, it's still a mild illness and just a flu-like illness. Most people have fever, cough, and they become all right. Many of them don't get themselves tested also. If you test, many of them would be COVID positive, but they've recovered on their own with just symptomatic treatment.
Okay. So essentially in an office setting, just yet, closed doors, everything is closed. We have central air conditioning. No need to wear a mask is what you're saying at this point in time.
Yes, but if you have comorbidities, if you're in the high risk group,
Okay.
a safer option would be to wear a mask and use a hand sanitizer.
What about those face shields, are they of any use at all? Should people wear them?
No,
Comorbid
I
and
don't think
senior
that
citizens.
we don't have that type of situation that we had in the pandemic. I don't think we need to really go there.
Right. Dr. Guleria, monsoons and the link with COVID-19. What is the connection? We see an increase in Maharashtra, in Kerala. These places are receiving heavy rainfall. Is there a link now between the rains and the infection?
So if you look at data which we have from influenza, it shows that in India, unlike say temperate areas like the US or in Europe, in tropical countries, the respiratory viral infection, especially the data is from influenza, tends to peak during the monsoon months. And in India, except for one area, that is Srinagar, where you get the influenza only during the winter months, all in other parts of our country, we see a monsoon peak which follows the monsoon months. So it starts in May or April, May in Kerala and western part of India. It then goes, it peaks during the monsoon months in North India. And in Chennai and eastern part of India, it actually peaks during October, November, when the monsoon is receding and going from that side. In the northern part of India, we also see a peak during the winter months in Delhi. So we see two peaks in northern India, monsoon and winter. But in the rest of the country, especially southern part, it definitely follows the respiratory viral infection tends to follow the monsoon.
Okay. So there is a link clearly is what you're saying, because at the end of the day, this is a viral infection, isn't it?
Correct.
Okay. Someone is experiencing cold and cough. They could just be under the weather in general. Should they be getting tested? Now, should everybody be rushing for these tests? Who should be going for it? What's the basic guideline that you'd like to share on that?
So if you're not in the high risk group and you're not elderly, and you just have fever, cough and cold, I think just symptomatic treatment is required. You don't need to get worried. And unless your fever is persisting for a longer time, it's high grade fever, then it may be worthwhile. Otherwise, for mild illness, it's no need to get tested. For the elderly and those who have comorbidities, if they have fever, cough and cold and they're feeling a little breathless, or they have some low respiratory tract symptoms like cough with sputum production, breathlessness, chest tightness, they should get themselves tested. And the reason for that is not only to know whether they have COVID, but to really look at what we can do. For example, this can be because of influenza and this can be because of COVID. If it is because of influenza, then you have a separate antiviral available. You can give oseltamivir or Tamiflu. If it is because of COVID, then you have separate antiviral drugs available for COVID now, and you can give those drugs to these people as antiviral drugs, which will help them in terms of decreasing the viral load and better sort of recovery as far as the illness is concerned.
Okay, so basically it's just to help the patient, giving the patient the right medicine, and that's why getting tested is important. Okay, now I want to ask you, a healthy individual, say tomorrow if I'm not feeling well, just by way of precaution, should I not expose myself to others around me in a closed setting particularly? Should I be, calling in sick?
So if you have a flu-like symptom, you have fever, cough, cold, you're sneezing, you're coughing, and that's true even for children, I think then they should stay at home and not go out, because then you can spread the infection to others. And it's well known that children who would either go to school or to a play school, if they are coughing, they will give it to other children. These children will then carry the infection to their homes and give it to the elderly or the high-risk group at home. So to break that chain, it's important that everyone who has fever, cough and cold isolates himself so that they don't spread the infection in the community.
Okay, I was just coming to that, isolation, because everybody is afraid of isolation. Certainly I am. If I get tested positive for COVID-19, that rule remains the same. I must isolate at least for a couple of days. And how many days would that be there?
So at least for 5 days, and I think it's important so that you don't spread the infection to other family members and to your friends who come in contact with you. So it's really to protect them, especially if they have comorbidities or they're at risk for getting a more severe infection.
Dr. Guleria, would you expect cases to increase in the next few days? Is that a suspicion? Would we expect?
So I think we will gradually have for the next few days, there may be a slight increase in the number of cases. It will then plateau off and come down. But I don't think it's still a cause of concern. This is being closely monitored by the WHO in India, by ICMR, and whatever data we have as of now clearly suggests that it's a mild illness. It's a Omicron variant which is causing only a mild illness. Those with higher risk group definitely are the ones who we need to watch out for, because they can get a more severe illness because of their old age or comorbidities. But otherwise, for the population at large, it's still a mild illness.
Thank you so much for joining and as always sharing your views with us. It's a pleasure having you. Like I said, thank you so much, sir.
Thank you. Thank you.
Joining us right now is Dr. Arjun Dang. He is the CEO of Dr. Dang's Labs. Thank you so much for your time. The reason why we are connecting with you today is because once again, COVID has raised its ugly head. I want to begin by asking you, talk to us a little about the kind of increase that, testing has seen over the last few weeks or so, given that many people are now, falling sick. And of course, they would want to find out whether it's COVID or whether it's, the regular flu.
Of course, unfortunately, we have seen a resurgence in the COVID cases again. And of course, with that come pressure and more requests also for the particular test. Now, I think this phenomenon has been around since about close to 10 to 12 days. And before that, if you look at our data of May, there were very few tests that we were performing and also getting requests for, but there has been a recent surge. And of course, the RT-PCR test, that is the gold standard, is what is currently being asked for by the symptomatic people.
Right. I want to ask you, you did mention that there are variants that are more virulent which are being seen in certain states. Talk to us about what your assessment of the situation is vis-a-vis the more transmissible variants.
Of course. So currently, when we speak about the various variants, there are broadly 4 in circulation right now. And of course, the one that has got the maximum attention is the JN1 variant that has been seen to be maximum in circulation. Apart from this, we've also seen NB181, LF7 and XFG also. Out of these, JN1 has been called as a variant under monitoring by the WHO. And currently, even the symptoms and the signs that we are seeing in patients are again flu-like. And also, fortunately, a majority of the cases that we've seen are also recovering within a few days. This is probably because of the previous immunity that they had, and also because this particular variant is not seen to be as severe. But then again, from a transmissibility perspective, we are seeing that it is easily transmissible.
Just thank you, Dr. Dang.
Of course. Thank you.
We need to be very vigilant and have good surveillance. You're right, we're seeing a lot of outbreaks. This century, the last 25 years, has been a century of outbreaks. We've had 2 pandemics, the swine flu pandemic and the COVID pandemic. We've had outbreaks of SARS, MERS, Zika, Mpox, and a large number of other outbreaks over the last 25 years. Therefore, there is definitely a sign that there is overcrowding, we're encroaching the environment. There is also travel which is allowing the infection to spread rapidly. Air travel has become very frequent, and all this tells us that we need to be more vigilant and have a very good surveillance plan in place and an action plan in place. And the government has been doing this over the last few years so that we have very aggressive surveillance for any outbreak or any new virus which may emerge.
What exactly is Disease X? Is it already here, and could it trigger the next global pandemic? Well, Disease X isn't a specific virus, it's a warning sign. The World Health Organization coined the term in 2018 to represent an unknown hypothetical pathogen, one with the potential to trigger a serious global outbreak. Well, it's not science fiction. It's actually a symbol of preparedness, a call to arms for scientists, health leaders, and governments to brace for the unknown. So why does this matter? Why does the conversation around Disease X matter? Because COVID-19 was the first real-world example of what Disease X could look like. A virus no one saw coming, a pandemic that changed the world. Why does the world fear Disease X? Well, it does so because it represents what we do not know. It's an unknown enemy. It could be a zoonotic virus jumping from animals to humans, a lab-created threat via synthetic biology, a drug-resistant pathogen that no medicine can treat. So what will be the World Health Organization's strategy? It's ideally going to be developing broad-spectrum antivirals, invest in rapid response platforms like the mRNA platform, like the mRNA vaccine that was also developed during COVID-19. Build stronger epidemic surveillance and infrastructure. The question is, are we seeing signs of disease X surfacing in 2025? Yes and no. Disease X hasn't arrived, thankfully. But the world is on high alert as major outbreaks have been seen. What are these outbreaks? It's not just COVID-19 in continuum. It's things like measles, which is back with 370 cases in the US alone, more across Canada and Europe. Mosquito-borne diseases like dengue and malaria, which are spiking in newer regions where they were never seen before because of climate change. Tick-borne illnesses have surged over 200% in places like Long Island. Thanks to warmer winters, again climate change, we can't look away from it. And of course, COVID-19, which is mutating year after year, literally month after month. There's so many mutating viruses as far as COVID-19 is concerned. Variants of concern which have been mutating over a period of time, like NB.1.8.1, which are pushing up cases across Southeast Asia and India, our country, like we've seen. The truth is, the fact is, we may not know the next name of the pandemic, but Disease X reminds us that we can be ready for it. At least make an attempt to be ready for what could possibly be our reality. Well, that brings us to the end of this edition of Health 360. We hope we could answer all your queries related to the infection and the do's and don'ts. Watch this space for more stories around the pandemic, health, wellness and fitness. As always, that's India Today's digital platforms are carrying all these reports. YouTube, Facebook, Instagram and Twitter or X. Health 360 and Health 360 Plus are our hashtags. Do like, subscribe and share. Thank you for watching. Be safe, be healthy. Bye for now.